The conditions that pediatric orthopedists treat range from birth defects to sports injuries that require different methods of treatment. We spoke with Dr. Francois Lalonde of Children's Hospital of Orange County about what he sees in his practice.
A lot of patients will present with sports-related injuries, such as it could be as non-specific as knee pain or hip pain, something secondary to overuse in their sport, whether it's overhead activities in volleyball or tennis or water polo, for example, or baseball at the elbow. So there's a subset of visits that are just related to their particular sports activities. There are others that are more injuries during that sport activity, including some of the recreational activities such as skateboarding or waveboarding, which are very common here in California. It can vary, but we break it down into traumatic or sports overuse injuries and developmental or acquired problems. There are two main conditions. One is the clubfoot, and we'll get a call from the newborn nursery to have initial contact with the family, or in the first week after they've been discharged from the hospital to start treatment with, which is now clubfoot casting, so a series of casts. And the other condition is they'll be on a newborn exam in hospital. They'll be diagnosed with a hip instability, meaning the hip is dislocatable or dislocated, and then we're called in to put a little harness on the infant and start the treatment at that time. We often get asked by the families when they should seek medical attention for their child's injury, and the general advice that we give the parents is obviously if it's a major injury, it's obvious there's maybe a gross deformity, then it's easy for the families to decide. In that case, they should probably drive to the major pediatric center right away and bypass a community hospital, because that's likely where they're going to get their ultimate treatment. And the younger the child, the harder it is for them to communicate to their parents, the extent of their injury. So if ever in doubt, we tell the parents it's probably wiser to have it looked at and to wait. We would prefer to see children with any type of congenital abnormality or acquired deformity earlier than later, because our intervention, if done early enough, can be reversed, or the outcome is much better than if we do the same type of surgery at a later age. It's a well-known fact. Luckily, we can still recover later on if they present late, but the success rate is significantly improved the earlier the child presents with either a congenital or acquired condition, or even as a result of trauma. I think in terms of injury prevention in some of the year-round sports that we see here in Southern California, the message that we want to get across to the parents are that there should be an importance and a focus on stretching before the activity, whether that's with a team or also at home. And also, it's a good idea to alternate between sports. Your child may have one major sport of interest, but it's a good idea to cycle off of that sport for 3 to 4 months out of the year to a different type of sport that uses different types of muscles or joints, because the chances are that you're not going to get into the overuse conditions as much that way. I think in baseball, the parents and the coaches have to be mindful of the pitch count and the guidelines established by the Baseball Association about the type of the pitch that should be pitched at which age and the pitch count. And so little things like that can go a long way to prevent a lot of the injuries and conditions that we're seeing through the office. We enjoy working with children and the families. They're very resilient age group, and I like to think that and simple in a way that there's no hidden agenda with children. They're very innocent, and they talk to you truthfully. And we also enjoy the interaction with the parents and the importance of treating their child. The child is so precious to the parents, and so it's an important part of what we do.